to introduce our first speaker for the day, Dr. Chong, who will be sharing some of the latest insights and best practices in kidney cysts. Hand over to
Today I'm
you.
going to talk about kidney cysts. The key thing is, when is it dangerous? I'm a main panel doctor for this personal medical insurance for private sector. And today I'm going to talk about evaluation of kidney cysts, what to do when they have thing to be benign, and what to do when the cysts are suspicious. And I have a suggestion of outpatient GP plans when you see kidney cysts. There are a few misconceptions of kidney cysts that we know, and these are all fake news. And patients may have Google and then come in, or oh, even now it's ChatGPT, and then a whole list of questions that come to you in your clinic. Number one, fake news is the bigger cyst is more likely to be cancer, which is not true, because cystic renal cell carcinoma can be of any size or shape, can be a small cyst or can be a big cyst. And second fake news is cancerous cyst is usually painful. That's not true. Majority of the cysts that have cancer have no pain and no symptoms, but you manage to pick it up during health screening. The other fake news is only big cysts can cause pain. Well, that's not true. Many of the kidney cysts can be small or big, and they can always cause pain when there's infected kidney cysts or there's an internal hemorrhage with bleeding inside the cyst. These all can cause pain. Another fake news is benign cysts usually harmless. Well, that's not true, because the cyst can be in different location of the kidney. If a kidney cyst is in the parapelvic area, which is next to the renal pelvis, it can actually cause obstruction and cause hydronephrosis of the kidney, even though it is a benign cyst, but it's the location that causes the urine outflow obstruction. How do we decide whether a kidney cyst is dangerous or not? Dr. Bosniak is a professor emeritus in radiology from New York University. Long time ago, he divided all the kidney cysts into 5 different categories with an original publication in 1986. He looked at CT scan with contrast and decide which cysts are dangerous and which one can have cancer. In 2019, there's a new proposal that update the classification that includes MRI scan now, because some patients do MRI now instead of CT scan. So this is the latest update for Bosniak classification of cystic renal mass, and there are different classes. In your CT scan or MRI scan report that you get from your patient, they should usually tell you the Bosniak classification. Each of the classification determines what is the risk of cancer in the patient. One of the important thing is, whenever it's a Bosniak 3 or 4, it is likely to have cancer. So in summary, this is a very good slide to tell the patients. When the Bosniak classification of the cyst is 1 and 2, I tell them there's almost no cancer found at all. And I actually tell patients you don't really need follow-up. But when the patient has kidney cyst that's Bosniak classification 3 or 4, you look at it, 50% or 100% of them have cancer found inside the cyst. And this requires surgery, and a urologist should have a look at it. There's an intermediate category called 2F. What does it mean? It means it's type 2 and follow-up. F for follow-up, because the radiologist think is between 2 or 3. So for patients who have classification of 2F, I usually tell them we repeat scan in 6 to 12 months time and subsequently make sure it doesn't become worse. This is the usual follow-up that I follow. What happens if you look at the kidney cysts and they are benign? What can you do? Well, of course, you can monitor, because majority of the kidney cysts that's benign, Bosniak 1 and 2, are harmless, and you can simply monitor them. What happens if patients are symptomatic and want to do something? Well, we can do an aspiration of the liquid in the cyst and also do a surgery to do de-roofing. What is a cyst aspiration? Well, first, you use a percutaneous aspiration and you put some sclerotherapy into the cyst to shrink it. A second thing we can always do is always do a keyhole surgery, laparoscopic removal of the cyst wall. What happens if your kidney cyst is suspicious of cancer inside? You cannot just remove the content, because the cancer cells can spread all over the abdomen cavity. So we must treat it like a small kidney tumor and remove the entire cyst out of the kidney itself. It's called partial nephrectomy. And another thing some people may ask, can I do some energy ablation like cryotherapy, radio frequency ablation? That is actually not the standard of care. So for the next few slides, I'm going to go through one by one. So first is what happens if it's a benign cyst and you want to do something. Well, we can use a percutaneous cyst aspiration for patients who have simple cysts, especially in children and adults. And also, there are patients who actually have polycystic kidney disease. There's so many cysts in the entire kidney. You want to simply aspirate the bigger cyst and also to put sclerotherapy in that cyst because you don't want to operate on patients unnecessarily. Because we know that autosomal dominant polycystic kidney disease have a risk of getting more and more kidney cysts in the future, and they can always have a chance to go to kidney failure. This is one of the studies that they see in children in the United Kingdom, Royal Manchester Children's Hospital. What they do is they look at whether children are having pain or no pain, and then the kidney cysts, they will try to do percutaneous drainage first, and if it doesn't work, they will do keyhole surgery or open surgery. This is an example of one of the patient, 5-year-old girl with recurrent urinary tract infection. They actually aspirate the cyst and they put doxycycline into the cyst wall itself. You can see it shrink over the next couple of months, become smaller and smaller. And the patient, 5-year-old girl, has no more infection and no more pain. What about sclerotherapy? There are many, many ways you can put sclerotherapy inside the cyst. Some people put, like just now for the children's hospital, doxycycline. Some people put foam. Some people put alcohol. You can put many things to let the kidney cyst shrink. This is one of the studies that look at the polycystic kidney disease of 66 men, and they look at the different types of mutation classes of each patient. Sometimes, this is a Canadian study, overall they say it's a safe procedure. Sometimes, after cyst aspiration, you look at this, one of the bigger cysts, the kidney function actually improve with time after they aspirated the kidney cyst. But there's another patient, similarly, you do the same aspiration and put the same procedure, the kidney function worsen. So the authors says that sometimes it goes up, sometimes kidney function worsen, they never know why. So, but the most important thing is they will only treat patients with symptomatic cysts that's bigger because there are so many cysts. What happens if the aspiration doesn't work? There are some patients who say, I don't want to try making the cyst smaller. How about just remove it? Yes, we can do it. What we do is we do a keyhole surgery. This is an example, a picture of a keyhole surgery of the right kidney, where you can see the kidney cyst at the roof of it. And what we simply do is use the scissors to cut out a wall of the cyst and suck out the liquid so that it doesn't happen again. So it's like if you have a balloon where you blow the balloon, the air can go in and out and you can repeatedly blow the balloon. What happens if you cut the skin of the balloon? Whatever you blow in the balloon doesn't expand anymore. So that's like cutting a piece of the balloon. It's the same as cutting a piece of the kidney cyst. This operation is about 1 hour, and most of my patients go home the next day. And this is a simple laparoscopic surgery. What happens if the kidney cyst is Bosniak 3 or Bosniak 4? You must treat it as if there's cancer inside the cyst. Well, some patients actually say it's no pain. Actually, there are patients who decide to monitor. But what happens if we need to do a surgery? We do partial nephrectomy. So we only remove the wall of the cyst itself and we leave the rest of the kidney behind. Do not take out the whole kidney because the rest of the kidney are normal. Just remove the cyst itself that's suspicious. We know in the 50-year anniversary monogram for Cancer Society, many patients are found to have prostate and kidney cancer more frequently over the last 50 years in Singapore. And these two cancer will definitely be found more and more frequently, and it can come up in your health screenings as well. Are there any symptoms if there's cancer in the cyst? No, most patients have no symptoms at all because they're detected only from health screening. Of course, some patients do have symptoms, blood in urine or back pain, but that's not common. Unfortunately, when we look at Singapore for kidney cancer, in up to 2017, 50% of patients can be cured in stage 1. But many patients did not do health screening or they come late. and about 1/4 of patients are already in stage 4. That's too late. That's because most of them do not have pain. So health screening is so important to detect patients who have kidney tumor in the earlier stages. When it's in the earlier stages, we call it stage 1, and then it's less than 7 centimeter. And partial nephrectomy should be considered. So this is what we do for patients who have kidney cysts, Bosniak 3 and 4 cysts. I'm going to show a video of what it looks like, and this is routinely done. I also do it by robotic surgery now, and this is a schematic diagram of what it looks like if somebody has a kidney cyst. So this is, for example, on the patient's left kidney, there's a kidney mass in the kidney. Now we use robotic surgery to cut out only the tumor. This video has no sound, so I'll be telling you along the way. We mark along the edges of the mass that we want to take out. And because there's a blood vessel going to kidney, we want to clamp the blood vessels. You see the clamping of the renal artery and the vein, and then stabilize the kidney while we use the scissors to cut out only the mass, which is why we call it partial nephrectomy. After removing the renal mass, we close and stitch up the hole itself, and the sutures will dissolve itself after that. So this is what we do when we do robotic partial nephrectomy. We find Da Vinci robot much better now rather than open surgery. So now everything is keyhole now, and the blood vessel clamps come out, and patient go to the ward and they can start drinking soup on the same day already. Why is robotic surgery so good? This was me when I was younger, when I was in New York City doing my training. At that time, I was able to do open surgery and Da Vinci robot. So for open surgery for kidney tumor, we used to do 3 operations a day, 3 kidney tumors a day, at morning, lunchtime, and evening, afternoon. So we do 3 surgery a day. But when we do Da Vinci robot, we can only do 2 because the setup time takes a bit longer. But nowadays in Singapore and a lot of urologists here in Singapore, we use Da Vinci robot to do it because the stitching is much better and it's keyhole and patient recover faster. Who is suitable for Da Vinci robot surgery? Anybody, no matter how old they are, we just remove the kidney mass, just the Bosniak 3 and 4 cysts. Any age is fine because we want to save the rest of the remaining good kidney. There are some patients who ask, Doctor, I don't want operation. Can I do something called energy ablation, like ablation using microwave, cryotherapy? I say no, because it's a water liquid, and then the renal tumor inside it, we do not want to poke it accidentally, and actually the tumor cells spill outside. So energy ablation is not to be used for cystic renal mass. This is a few more slides, and this is my suggestion, summary slide of what I think you can consider doing. And it's only one slide. So this is my suggested workflow to see whether it fits into your practice. Once you have patients ultrasound scan, if it's a simple kidney cyst, you can either decide to observe it because there's no symptom, or if patient have pain or discomfort, refer to urology to see what else we need to do. What happens if the ultrasound of your kidney says it's complex cyst? You can do a CT scan in your clinic, but you need remember to give a contrast enhancement so that we can see the internal part of the kidney cyst. If the CT scan says that it's a Bosniak 2F, 3 or 4, the potentially dangerous cyst, please refer to urologist in case we need to do surgery. Of course, there are some patients with mild kidney failure, mild renal dysfunction. When you have kidney cysts, what to do? Well, discuss with a radiologist or renal physician. And patients with EGFR more than 45, you can give contrast without problem. You can always have kidney-friendly CT scan. There are some hospitals that actually do Doppler ultrasound with microbubble. They actually put microbubble into the patient and actually do not give a CT scan contrast. Of course, there are patients who can also try to do MRI scan without a CT scan. And the other thing to consider, what happens if someone has CT contrast allergy? You can always give an MRI scan with gadolinium contrast. So this is a summary slide of my suggestion you can do from your clinic if it fits into your workflow. With that, I want to come to the last part of my talk. I usually tell everybody, especially the patients, well, are they happy? I always ask them. Why? Because I tell them sometimes don't have to worry so much about your benign cysts. Some patients, when they see health screening, anything abnormal, they'll be so worried and scared. Say, don't worry, some cysts are not harmful, so you can just monitor. Well, more important to look after yourself with self-care. We should make friends, have your own inner peace, love others, and exercise. This usually make them more happy than me telling them how often to come back for screening, how to monitor the cyst. And if they are happy, they will be cheerful and live well. So I also want to end this talk by telling, because I've learned a lot from my patients, some of my friends and I, we started a program in Thailand to reduce stress and reduce burnout so that we don't get so stressful in life. And this is called drheals.com. And we have medical doctors and wellness experts to run the program. So if you have time and see whether your patients would like to use any of these services, drheals.com. The other program that we know is that patients always Google for medical news, and sometimes they see fake news and actually follow the fake news and no good for themselves. So we started the asiamd.com. We wanted to provide healthcare articles, wellness updates in English Mandarin so that people know that it is actually written by professionals in healthcare and doctors. So if this is helpful, maybe your patients see whether they would like to follow our websites and our articles. With that, I thank you very much for your time, and may God bless you. And thanks for following my talk. Thank you.
Thank you, Dr. Chong. Please
Thank you.
stay because we do have some doctors asking questions. So we have this anonymous. Okay, what tests are available for renal cancer? Is Ufemi sufficient?
So that's a very good question, because everyone is trying to find one test that can actually look for kidney cancer and many other cancer. Unfortunately, for kidney cancer, there is no one good marker. One of the tests that we did in New York was a CA9 marker, and some of them are trying to add this molecular isotope into CT scan to light up CT scan, but it's still in the clinical trial experimental stage that not everyone do. So there's no blood test or urine test that can check for kidney tumor. I will tell people, do your ultrasound health screening of the abdomen, and you can pick up many things, including liver or other things. And also, if you have blood in the urine, microscopic hematuria, they can't see it, but please see a doctor to find out more. Is there a urinary issue?
So early detection is always the key, right? And how can we tell the kidney cysts require surgery? A complex, like what? Do they feel pain or even blood in the urine?
Two questions I ask patient: is it painful? If it's no pain, I sometimes just observe. If it's painful, we can always find out whether it's dangerous or simple cyst, and we can do surgery. So most of my patients have simple cyst that's not cancerous. I always wait until they say they really have discomfort, it affects them. And anything more than 4-5 cm will sometimes compress on the kidney. Second thing is, sometimes the cyst is small, but it's actually in the junction between the kidney, renal pelvis, and upper ureter, and causes hydronephrosis, which means the blockage of urine flow. I will also operate to decompress, to remove the fluid so that the urine flow is not blocked and their hydronephrosis will clear.
So let's say, for example, right, if we don't feel pain at all, but then our urinary bladder or like, the tummy area getting very big and bloated, right? So I think that's also the sign that we have to go and do a detailed scan, right?
Whenever there's anything uncomfortable, I tell patients, see your GP and your primary doctor who usually sees you, who knows you a bit better than specialists, and then they can do more tests, because there can be many reasons why someone's have abdominal pain.
Okay, thanks, Dr. Chong, for today. So if anyone, looking for the urologist in Singapore, you can look for Dr. Chong from Sochi 10 Specialists located at Farrer Park Hospital.